So what I'm going to talk about today is infraorbital rim implant, which is made out of solid silicone. It never has to be changed. That's why I like it. Also, it's completely inert. Nothing sticks to it. If for some reason it needs to be removed, which is very unusual, it can be removed because again, nothing sticks to it. Now, I use a customized infraorbital rim silicone implant. This is a skull. It's not an actual skull, so it's not ideal, but what you can see is it's made for a shape that contours to this area. However, what I do is almost always I trim it based on what the patient wants to do. If they want more of the cheek, I leave more of the cheek alone. If I want to be able to raise it a little bit, I can raise it. I can trim the inner, I can trim the bottom. I customize it in surgery based on what fits the patient's best and what their desired goal is. So that's very important. All right, and so the implant goes over here. So this is ideal for patients who have bony deficiency here, lack of bony support. A lot of times these patients also have eyes that are more protruding. Once you augment the bone under the eyes, it balances the face-eye ratio much better. The eye becomes less bulging. So again, the implant is going in this location, and if you want to see a different model, this is obviously a much exaggerated, larger model, but the implant will go in this location. The technique of the implant insertion is absolutely critical. What I do is I go use a transconjunctival approach. I do not make a skin cut, because if you make a skin cut and go that way, you highly increase the chance of having complications with eyelid malposition and scarring. I've seen patients who've done it with other surgeons and the eyelid gets pulled down and or turned in or what have you. So you want to avoid that. So proper technique is absolutely critical. The other reason I go from the inside eyelid, because it's a very clean area, so the risk of infection is almost zero. I've never had an infection with this procedure. The alternative is to place incision from through the mouth. And that is obviously, first of all, it's imprecise because you don't have direct visualization, but more importantly, it definitely increases the chance of infection. Another very important factor is fixation of the implant, how you fix it. I never use screws. I never use anything metal because it usually has a much higher rate of complications because metal things stick to metal. And it really increases the chance of eyelid scarring and malposition, eyelid getting stuck to the implant. So what I do is fine sutures and I fix it to the orbital rim, periosteum, again using very fine sutures.